Hi, my name's Don Altemus, and I'm a transgender man. My pronouns are he, him, his. I'd like to welcome everyone to this fireside chat in celebration of International Transgender Day of Visibility. Today, we're going to have a discussion about accessing mental health care as a transgender individual and some of the unique needs transgender individuals have related to navigating healthcare, mental health care. Here with RJ GayByrd and Jasper Liem, and I'm going to let them introduce themselves as we begin this discussion. I'm going to pass off to RJ.
Hi, everyone. My name is RJ GayByrd. I am a non binary person. My pronouns are they, them, and I have experience with mental health professionals and navigating that as a non binary person of color. So, today I'm going to be discussing a little bit about my experience. Yeah.
Thanks, RJ. My name is Jasper Liem. I go by he and they pronouns, and I'm a person of transmasculine experience. And my background, I'm situated in Philadelphia, but my background is both as a trans person of Asian and Pacific Islander background, as a clinician as well. So I've been working with trans and gender nonconforming young adults for the past 10 plus years. So thanks so much for having us, Don.
So, hey, it's good to have you both here. Thank you very much for being here and taking part in this discussion. And just wanted to begin with, what asking about what your experience is with accessing mental health care services related to being transgender and any sort of barriers that may have come up in the mental health care system.
Do you
Sure.
want to go
Um, I can start. For me personally, I have had the fortunate experience of having a therapist for a few years. And that dates back even to before I presented and identified as non binary. And so they've been able to transition along with me and assist me in this new world of understanding and everything that comes along with being non binary in today's society. However, I have had other experiences where in the future I'm looking to get an affirming confirmation surgery. And before I was able to do so, I had to submit like a letter of support, just stating that I'm within my right mental capacity and um, that I fully understand the decision that I'm looking to make. And it was a lot of work for something that I felt wouldn't have happened if this wasn't a gender affirming surgery. So that was interesting to see the differences that I've had before I identified as non binary and today, now that I do. So, yeah, fortunately, I do have my therapist who was able to hold my hand as I learned more and more about not just myself, but just some of the things that I'm up against. And I'm still pretty young in my process, so I'm sure there's a lot more experiences to navigate through.
Yeah, thanks for sharing that, RJ.
Yeah.
My experience started probably about 12 years ago. I had been in and out of therapy for quite a while before that. But I was also fortunate to have a very gender affirming and queer identified therapist at a time when I was going through a lot of life changes, and gender was sort of one of those. And it was the first time in my life that I was called he, him, and Jasper consistently, which was kind of a mind trick. It was just, even though this was a name and pronouns that I felt really good about at the time, it was an adjustment for me to hear that and just learn to respond to a different name. I was very fortunate to have supportive family, and I recognize that that is not unfortunately not as common as I would like to see it.
Mhm.
I feel like it's becoming more common, but um, I felt like I was really lucky in that. And I was also and am still very lucky to live in a very metropolitan area where I have access to multiple choices for gender affirming healthcare as well as mental health care. I find that one of the things that's hardest, especially when I'm looking for like a trans or gender nonconforming therapist or someone who's maybe cisgender but competent in those things, is at least in Pennsylvania, most of my favorite therapists in the area use a private pay scale because the insurance system is just not set up to make it, financially feasible for most therapists. And then as a result, also not financially feasible for most folks seeking therapy. So I think that's one of the hardest things I've seen.
I think you're right with that, Jasper. The services and navigating costs and whatnot is definitely a barrier for some, especially as you said, because of the way insurance structures that make it difficult for therapists to be taking insurance, and the cost of services when it's not covered by your insurance is definitely something that is difficult for people to navigate. Like you, I have also, a very accepting family and whatnot, and I too really um, want to see the world go that direction, because that's something that I've watched, my friends who are transgender on their journeys, and I've seen some of them have difficulties that I did not have, just because of my family being accepting. And that's been really a blessing. I'm also located in Pennsylvania, but I'm not, I'm close to Philadelphia, but I'm not in Philadelphia. And so for me, early on, it was, I needed to travel into Philadelphia to find the services that I was looking for, to find that affirming care. And it's really nice to see that things are extending out, and I can get care that's closer to home now, that was not available at the time that I began my journey, which is um, really nice. And I also shared the same sort of experience with that difference in um, actually hearing my name, and actually hearing the pronouns that I identified with. It was there was a couple times early on that I can remember actually kind of doing a bit of a double take. You really mean me, um, and it felt good and weird at the same time. Um, and another thing that I know for me on my journey, as as a trans man, that was another piece that I ended up needing to navigate in the therapy services, was being viewed by others differently than I had been socialized when I was growing up, because I had been socialized to act a certain way, and to do certain things, and uh, my experience was different once people started um, treating me differently, because I uh, visually looked a little bit more like the person I actually was. Um, so that was another thing to navigate. And navigating all those things takes the need of a safe space. And so, how would you say, from your perspective, a therapist could create a safe place for a person to work through the challenges that they're facing, regardless of whether or not they're deciding to to transition?
Sure. It's okay if I start with that.
Mhm.
Um, I've had the great fortune of being both on both sides of that seat. I've been both a therapist and someone who's engaged in therapy myself for a long time. And I think if I was going to boil down sort of the therapeutic experience into one thing, it's about holding space, and allowing for things to happen in that space, whether that's just exploration, and that's also holding that there's no one or right way to transition. whether that's physically or socially or legally. I find that just giving the space to say, hey, let's just explore that, and almost like think of it as like a gender playground where somebody gets to explore like what feels right. The last 5.5 years before I came to the Atticus Center was at a health center where we did gender affirming care. And I can't tell you how many, young adults I talked to who were just excited to have a space where they could try on different names or try on different pronouns and see how that resonated with them, without the fear that, like, if they didn't have it right, that they would be kicked out in some way. And I remember that in my own experience as well, just how many times, even before I came to terms with my gender identity, how many times I found a therapist and I was like, okay, but being gay or queer or trans is not the only focus of my work here, right? I was also dealing with other things. And there were so many therapists that I was like, this is not going to work because all you can see is my identity and not that it's just one piece of the puzzle.
Yeah. To piggyback off of that, as I mentioned, I've had a therapist for a few years now. And before I identified as non-binary, I was a gay woman. And so I had already been navigating through just being a gay, masculine presenting woman in society. And my therapist was very supportive of that and just helped me understand, some of the things that were coming up for me, reasons why I had a overall feeling of, just being unsafe, and my past experiences that I've had from identifying as a gay woman and presenting masculine. So fortunately, because I have that past experience with them, during this transition, I didn't change any of my outer appearances or anything. So the only thing I really had to navigate through was changing my pronouns, changing my name. And she was very helpful with just helping me understand and uh, just figuring things out because, and on top of being non binary specifically, I'm gender fluid. So on a day to day basis, it can change. And I'm one of those people who like knowing things like for certain. And when you're just kind of going from place to place with your identity, it can be really confusing. And I didn't understand a lot. There were times where I was trying to put myself in a box because it was just easier for me to grip. And fortunately, I have a lot of supportive people in my life, my wife being one of them. And she helped me navigate that as well and just let me know that it's okay. If you wake up one day feeling like this or like that the next day, like it is what it is. And that's who you are. And you'll be loved and supported for that. So, just having that support definitely is very helpful, especially as I continue on this process in my non-binariness and understanding. And I'm sure there'll be other things that will come up, especially after I go through my affirming surgery. And I have a strong feeling and belief that my therapist and my family and support system will help me navigate through that as well, because they understand how important it is and what it means for me to live in my authentic self, despite how scary it can be out there in the world. So, yeah, definitely important.
And for me, that safe space again also allowed me to explore a lot of different things. The comfort level of being who I was. The my presentation didn't change much. I had always presented fairly masculine, and I had before I began on my medical piece of my transition, I was read as male by strangers probably about 85% of the time anyway. Um, but I did not, I, as far as dress and whatnot, I purposely did not present quite as strongly male. at that point because of safety concerns. If different places that I would be, I wanted people to realize that I was masculine looking and not necessarily for safety reasons. And so it came to be, becoming comfortable with presenting more male all the time, and changing some of those spaces that I was in, and to match that. And there was a lot of things that I needed to work through that felt really confusing. I remember the first time walking down the street and seeing a female presenting person who looked like they needed help, and approaching and um, having a reaction of the person being afraid of me, and then realizing that um, I was being profiled in a different way because I appeared more male than I did before. And so navigating how I felt about that change in the level of privilege, and also the just way society viewed me, was very different. And those were things that I really did need that safe space to be able to go in, and some days not have any clue where I was going to start, and have a therapist who was able to um, guide me through that, and kind of let me stumble through it as need be, um, which was a blessing to be able to have. And it's one of those things that like you said, Jasper, it was a piece of what I was dealing with. The identity piece was a piece, but that identity piece ended up affecting so many other parts of my life. It affected my relationships. It affected my who I am as a parent. It affected um, uh, dealing with fears of, was I going to have problems with my custody and whatnot because of my identity, and working through all of that, and getting up the courage to do some of the things that I really needed to do anyway. Um, and that safe space, if I hadn't had it with somebody that was willing to let me stumble through those things, I don't think my journey would have been quite as good as it's been. Um, and so that's a really necessary thing. Um, and so with that, the work that you've done with therapists, um, it's been touched on a little bit, but how has that affected any medical transition? And is there anything that could have made challenges less challenging with respect to medical transition in the therapy that you've experienced?
Um, so in terms of my mental health, I was very fortunate with who I do have, because they understood me as a person prior to being someone in this transition period of becoming non-binary. And so, because I've had those years of them just working with me through how I identified as just being a woman and masculine presenting, which has its own barriers and situations involved with that. Once I explained to them that I was even interested in the surgery, it was pretty supportive from the jump. And she asked how she could support me, because she understood that there are certain things that are required to go with the surgery, like the letter of support, and just what happens once you have completed your surgery, and go back out into society, as well as just getting surgery in general. It affects mental health. Um, However, once I did begin this process of deciding to get surgery, I had to really, think about how I wanted to move forward in terms of like legally, because there is still a piece of me who, because I'm gay and because I am married to a woman and my future children will have gay parents, there are obstacles that come with that. And I'm thinking long term, what obstacles will that provide for them? And I don't necessarily know if I am willing to go through those legal changes in terms of like my actual legal gender and name change because of fear of what can happen. I've seen the obstacles and I've seen some of the things that as a gay person I'm already up against. And I've talked to many people who have transitioned and have had children of their own, and their expression of, just fear and how complicated some things can be to navigate, especially with children. It just makes things a lot difficult. So that is honestly something I'm still working through in terms of legally changing everything, just because it's such an interesting time, and we're still working through as a society, just overall accepting of people of the community in general, but especially people under the trans umbrella. I think a lot of people just don't understand, and change and differences can be scary, which I totally get. Like you mentioned, like when I start hearing my pronouns for the first time and my new name, it took me a while to grasp, and I find myself even sometimes like being hesitant or like shocked that people call me it. But yeah, it's something that I'm still figuring out, in hopes that by the time I need to make a decision, we'll be even further in our understanding with people and, things like that. But
I was
yeah,
just
so far I'm just figuring out.
I think that's the thing. Like, we're all figuring it out all the time. Like, I think cisgender people are figuring it out on a day-to-day basis, maybe just like a little more in the background. I was just hearing on the radio this morning that the White House is going to announce the availability of like an X gender marker on passports that's supposed to go in effect sometime in April. And I was like, I didn't even know that was like possibly going to happen that quickly. I knew that it's been like talked about for a long time. In Pennsylvania, it's really easy now to get your like an X as your gender marker on your state ID. So, I think that things are shifting, but I think there's also still this very real barrier of like, okay, whether I medically or legally transition, like there are now like these sort of physical cues of gender and presentation that the rest of the world is going to see and maybe clock us. And I think, I also think we don't live single issue lives, right? So I am not just a transmasculine person, but I'm also an Asian transmasculine person. And Asian masculinity is really different than Black or Latinx or white masculinity. And sort of learning how to navigate those waters has been interesting or weird. It's made me think about my racial identity in a way that I didn't have to before. And especially as someone who, I grew up, in a Chinese family, but here in the States where most of my peers were white. And so it isn't something it wasn't always at the forefront as much as it seems to be now. And when my partner and I first got together, when we were getting married, and I was telling a few of like the clients and folks that I've worked with, like, yeah, I'm going to take some time off to go on my honeymoon. And, they were curious, and my partner and I decided like what we were okay with me disclosing or not. And almost universally, the response I got from clients was the same sentence with two different inflections. Either, wait, you're marrying a white woman because they thought I was a gay man, or, oh, you're marrying a white woman because they were surprised I was marrying a white woman. Like, and it was just so interesting to see how, like that intersection of gender and race was really kind of galvanized in that moment in a way I did not expect. And I think there's a lot of things about physical transition that I don't think I could have anticipated. The therapist I had at the time, like had seen a lot of folks through physical and legal transitions, and like, it was still like, wow, I didn't expect how much this would change. things like, the label I used to use before I identified as trans was as a, butch dyke was the label I self-identify as, right? And I remember walking down the street, like in like Philly's neighborhood, and saying something, and I said the word dyke out on the street with my partner, who was very femme presenting, and got these stares. And I was like, oh, you all think I'm like that guy who's using this derogatory term that actually is one that I used to use for myself. And so like these little nuances in sort of gendered culture were a lot to navigate and learn. It was almost like I had to be more aware of I guess the closest thing I can think of to it is like the microaggressions that we go through in life, but I had to like be cognizant of them in a very different way. So, and I think ironically, the more comfortable I felt in my masculinity and in my physical body, the more I felt at ease playing with it. I was very aware that I didn't want to sort of fall into a toxic masculinity type of culture. In fact, I was pretty disgusted by some of the things I would hear from like my cisgender male counterparts. But and so I actually like was able to embrace more like a love of pink and purple or like Hello Kitty or whatever it was, because it didn't throw into question like my gender identity, because like my physical appearance was sort of getting more solidified into the like male bucket, if you will. So it's just interesting to see how that all shifts. I think one of the things I've noticed, just to go back to the question about like mental health barriers, RJ, you had mentioned needing the letter for support. And it's one that I needed that back when I got my top surgery. I want to say it was like 2008. And for whatever reason, I think the standards of care were different. For folks listening in, WPATH is the World Professional Association for Transgender Health. And it is the standards of care that is most often used, at least in the States, for gender affirming medical care, as well as like a significant portion on like mental health care for trans and gender nonconforming folks. But one of the things that it sort of strongly suggests / basically requires is a letter from a mental health provider if you're getting gender affirming surgery. And if you're getting anything that affects your genital or reproductive health, you actually need 2 letters, like one from a mental health provider, and the other, they say also can be from a mental health provider, but what I'm finding is a lot of insurances are requiring that second letter to be by somebody who has a doctorate level, so a psychologist or psychiatrist. Sometimes they'll take like a medical doctor or a doctor of osteopathic medicine. But, I'm finding more and more that there's these like gatekeeping rules. If I wanted or needed a hysterectomy because of, a different medical condition like fibromyalgia or something, I wouldn't need that mental health clearance. But because it's identity related, I would need that sort of clearance saying like, yes, I am a person who experiences gender dysphoria, which I find actually not a kind of misnomer for me. I really love my gender. I just want to love it more or feel more aligned. And that says like, I have the ability to consent and I have the cognitive ability to consent. And there aren't other significant mental health diagnoses that are sort of influencing who I am. So, in WPATH, the standards even sort of stipulate like if somebody has a psychotic disorder, to make sure that like their gender identity isn't only when they're in psychosis, which is something I didn't think I would like have to navigate until I was a clinician and met folks who I was like, okay, we need to get some of this like well managed. And I think one of the hardest things about being a trans person who is both someone who has gone through like some medical transition and had to navigate both the medical and physical health world, but also as a clinician, was being thrown into this gatekeeper role that felt really gross, honestly. Because on one hand, I'm like, hey, I'm all about like for us, by us. And I also want to make sure I'm doing right by my clients. And so making sure my clients have a really good understanding of like what could life after surgery or after starting hormones or whatever look like? Do they have a reasonable sort of understanding of what that could look like? And also, what are some of the risks that can come from starting a medical transition? Not just in terms of like the health risks and all that. I was fortunate enough to work with medical doctors, so I didn't really have to worry about that part as much. But like, how is this going to affect your role in your family, whether it's your family of origin or your family of choice or a family that you are a parental figure in? How is this going to affect your peer groups, your access to work or school, or all of those other things that make up who we are? And that I think has been the hardest part for clients I've worked with to navigate, is just, okay, like, are you at risk of losing, your housing or your religious or spiritual community? And, what can we do to sort of mitigate that? So it's a lot.
That definitely is a lot, because losing those sorts of things, regardless of how right your decision is, it's a huge loss. And again, I feel like I've had a smoother path than a lot of transgender individuals, in that I have both a very supportive family, and in addition to having a very supportive family, worked within the mental health system. And so I had employers who were more on board with me transitioning and making those changes than a lot of the individuals around me did. And I watched some of the things that other people were experiencing that I did not experience. And those things are real, and you need somebody to be able to help you navigate through them. I know that if you look at the statistics on Trevor Project, that if you look at the number of homeless youth, and then you look at the number of homeless youth that are within the LGBT, and then you just break it out and look at how many of them are transgender, and you can see that there's a disproportionate number that lose their housing just because they came out. And that's a really unfortunate place for a young person to be. And I know, Jasper, that you work with youth, and so I'm guessing you have a little bit more background and experience on that.
Yeah, I see it a lot, especially with trans and gender nonconforming youth and adults, honestly, because if somebody has to go into the emergency shelter system, it's all gender segregated and it's all male or female. And so I've had a lot of folks who, might present in a very binary way, but be of trans experience and might not have access to the male or female shelter. Theoretically, there are rules about, like, hey, you should be placed on how you identify, but that doesn't necessarily mean that you're going to feel safe either with staff or other residents. I've met a lot of young people, especially, and honestly, especially in the warmer months when living outside is a little bit more doable in Philly, that, they feel safer, honestly, living on the street or in the subway systems or the tunnels, because they don't have to deal with that daily, not even microaggression, like flat out aggression from whether it's staff or other residents about whether or not they belong in an emergency shelter. And I think, if I think about like a universal thing that I think makes any human being feel whole and affirmed, it's that feeling of a belonging. For me, that was part of why I delayed my medical transition for several years, was because I didn't know other trans masculine folks who were like me. I knew trans masculine folks. A lot of them were a little bit older. A lot of them came from a very like binary, you are like, you transition and then you go stealth, which there's nothing wrong with that, but that wasn't me. I'm 12, 14 years into sort of my public transition, and I am still very out and proud about being trans. And I think it's actually really important, because I wish I had that more. It's just, we all need people. And I actually do have one trans cousin who lives in Amsterdam, but he's, I want to say, probably 10 years older than I am. And we never talked. Like, we didn't meet until we were both in our 20s. And we're both just really different people. And so it was really important for me to find other trans folks And then as I grew a community of trans and gender diverse sort of family of choice, it became more and more important for me to find other trans masculine folks. Because I had a lot of, trans feminine, trans women in my life that I loved dearly and were just great, but their experiences were so different. And what they were navigating was really different. So yeah, if I could say one thing, like, find your people. The internet isn't a great place to do that, usually.
It is. And what you just described, I related to a lot of that because I actually, I look at like what my growing up and youth was like and compare it to like what today's youth are going through. And it's so different because I didn't even know the word transgender till I was in like maybe my early 30s. Had never heard of it. And I kept finding these ways of trying to like be this is close enough. I can be okay like this because it's close enough. And so you use that term butch dyke. That's where I was early on, and I was going to be okay with that identity because I didn't know that there was any other option. I didn't know that being my authentic self actually was an option that existed. And it my world changed when I learned that. Um, and so like today's youth, they transgender is something that is talked about, and so they hear that and they see that but they've got a different problem than I have because they've got all of the negative viewpoints that for people that don't understand that it's on social media, it's on wherever. You've got the legislation that's being proposed and whatnot, and so they've got that to navigate. They've got they know the word exists, they know that the authenticity is a possibility, but they've got this whole other thing. And I quite honestly, I'm not sure which one's more difficult because I had no representation, but I also didn't hear those negative views. They've got the representation, but they're hearing the negative views, and I kind of feel like that's probably harder, because I kind of like made it up as I went along, and things are very different. And I today know a lot of people that did go ahead and transition and then go stealth, and I intentionally chose not to go stealth because I want them to see and hear people talking about being proud to be trans. And I believe, as RJ was saying earlier, that a lot of the things that we hear and whatnot are based in people just not understanding. And if we can help people understand what it is, then we can make at least some of that negativity go away. And that in turn makes the world a much better place for the youth that are coming up.
Absolutely. And I've honestly had experiences with family members from grandparents down to youngest sibling who's 10, 11, in that age. And, just the generational differences in understanding. I've been able to effectively have these conversations with everybody from each generation to where they can understand to the best of their ability, and they are accepting. I actually had my youngest little brother. Um, he came to me and he was like, I had someone in my class who, level of understanding again, this little girl who says that they're trans. And I was like, how do you know that? Because this was very early in my process and I wasn't sure of what he may have heard because, like you said, there's way more exposure. And he said that this person said out loud that someone called them she or her, and they corrected them to they. And another boy was asking, like, how does that work? Like, there's only one of you. And my brother chimed in and was like, well, my sister, they go by they, and she is still a girl, these levels of understanding. So it was really great to hear that even though he hasn't fully understood, he at least understands that part to where he gets that people are just people and they just want to be respected and celebrated and just a sense of belonging. And it made me really happy that he could have been quiet like everyone else. He is very outspoken to start with, but he stood up for this person, and I was like, that was one of the reasons why I decided to be open and honest with my family, because I don't want them to go out into the world and continue the level of thinking that it's always kind of been. And within this past year, there's been significant like levels of understanding. There's still times where the pronouns or like the names will get caught up, but I understand that, I was this person with these pronouns for 20 plus years, and they're so apologetic, like, I'm so sorry. And I'm like, I get it. As long as you keep trying and this is still very fresh, like, I appreciate it. And I appreciate you understanding that you made a mistake, because it's not easy. There are still times where I'll be honest, I'll let my pronouns pass sometimes, just out of making it easier on myself, because sometimes you just don't want to stop and educate and do all that in the moment. You just want to kind of continue on with your day. So yeah, that was really awesome to see. But I have faith in our youth because they're very, very outspoken this day and age.
So, thank you so much. And I want to check in real quick because I'm looking at time, and we've had a great discussion here. But I just want to see if we have time real quick to talk about the best way to support a transgender person with trauma related to transphobia that they experience in society. What would you say was be the best way to support somebody who's experiencing that?
Yeah, Don, I think that's such a timely question right now. There are more anti-trans bills trying to get through legislature across the U.S. than ever. They're always lurking in the background, but like there's a hard push this past 6 months or a year. And I think that's what when we talk about the need for any person to belong, that's where like these bills make me so sad. Like I think about bills where parents are now having to decide whether to affirm their trans child, knowing that like all of the research shows that is a way to mitigate suicide risk, but also like with the potential of being separated from their child because of these new laws, like what's trying to pass in Texas around calling it child abuse. Like I cannot, as a parent, I cannot imagine having to try to make that decision between affirming my child and keeping my family together. And I think that it sort of brings to the surface the fear that a lot of cisgender parents have about how do I support my trans child, whether that's a young elementary school aged kid or an adult child, is how do we support the people in our lives who are trans, especially if that is not our experience. And that's just I think for me it comes down to remembering that these are still your family. I think that this is why a lot of trans folks do seek support and belonging in sports, for example. So taking that away from trans folks it's heartbreaking to me. Because I think we're all just people trying to find a place to belong. And the more we take that away from trans folks because of this one piece of our identity, the more it puts us at risk for increased mental health issues. And it is traumatic. It's an aggression in a lot of ways. Even as someone who I think is sort of more remote or like less involved with those things, like I don't do sports. I am not under 18 anymore. Like I don't have to worry about some of these things in terms of my personal life. But it breaks my heart because I know how important it is for me to be able to access the other places where I do belong, regardless of my gender identity. And so, I think that for those who are listening who are not part of the trans experience, to just remember that we all need a place to belong, and finding ways to find that humility and vulnerability to say, hey, this person is going through something I don't understand, and being okay with that, being okay with saying, hey, I don't know. Do you want to tell me more, or is there somewhere I can get this kind of education or experience? There are trans health conferences that happen all over the country, all over the world. The Philly one is put on by Mazzoni, and it's coming up in July. It's going to be hybrid, so it's actually, maybe it will be a virtual this year. I'm not 100% sure, but I know there's still a virtual component this year. And it's a great way to connect with other folks if you are trans, and to find ways to hear from the communities, like how do you how do you become like a really solid cisgender ally. But yeah, I think love it on your friends. Really
Yeah, that's a great point. Like, getting educated is probably the most important thing I can say, because it helps in both the long run with teaching the next generation that, people are just people no matter how they decide they want to express themselves or how they identify. But also, it'll help break down some of that fear that people have when they see a trans person on the street. I think if people are just more in the know and understand that, people can choose to express themselves however they want, or choose to dress or identify however it is, it will become more normal. I think quicker than before, because of social media and the exposure that we have all the time, constantly. And just like, in my lifetime, I remember a time where I was afraid to come out as gay because, being gay was, uh, I'll say, more frowned upon as a society. We're not all the way there yet, but it's definitely more accepted now. And that just
Mhm.
took exposure and education. So I feel like this is something else that can benefit from that exposure and education, because people don't know what they don't know. And once you actually understand and you see, then you'll understand there's nothing to worry about. And then everyone can just be treated normally. And hopefully, soon in the future, it'd be awesome to see in my lifetime, but people can just be people. We won't even need labels, honestly. But I know that's a long way. Wishful thinking, but
It is a long way, but I think we are headed there. I
yeah.
really do. And I did notice in the comments that somebody had said, realizing, a person's boundaries, it's okay to ask questions, but be mindful of what questions you're asking, and be mindful of not asking transgender individuals questions that you wouldn't ask a cisgendered individual, specifically, like what's in your pants sort of thing. Because those kinds of boundaries and all that, that's private information, and it's one of those things that when you're different, sometimes people make assumptions about what they can ask about, and it's really important to uh, realize that people are people, and we're all looking for a place to fit in, and maybe we'll someday see that world where everybody's just able to do that. Want to thank both of you for being here today, and for sharing your experiences and whatnot. Want to thank everybody who tuned in for uh, listening, and taking away what you take away from this, and just appreciate everybody being here. Thank you very much.
thank you, Don. Thanks for
Yeah,
joining.
thank you so much.